the medications like tramadol, which we could give an addict to control their pain, will activate the system and cause cravings for whatever the drug is. Remember that center, it is hooked into your memory, your logic, your emotions, all those brain centers. The first chemical probably activates that center, that system, to some degree, and it starts to turn on, and that pleasure is felt, and the nucleus accumbens acts in this abnormal way. After that point, the brain will remember what was the drug of choice and cause a change in fixation and a change in motivation. And this is what leads, I believe, to people turning back to their drug, the drug that they use. The drug of choice is just simply what the brain remembered as the most rewarding. Many patients who are in recovery and who have pain, who I've treated, come to me sometimes before I've seen them and told them to avoid opiates for their pain, or just after surgery and are getting pain control. And they tend to have the same story. If they really want recovery and if they're being honest, they will often tell me a story when their surgery's over. They will say that, when I got those Vicodin, the craving for the Vicodin was far worse than any pain I was experiencing. And I'm so glad I got off it. It was a horrible experience. So what can you use? These are some things that your doctor would be okay for you to use. Motrin, naproxen, which is Aleve, Toradol, which is a very powerful non-steroidal anti-inflammatory, Tylenol, ice, rest. These are things that we think, well, definitely the answer for something wrong is a pill, right? The people who are absolutely convinced that the answer to all their problems is a chemical, that's the addict group. It's hard to talk to them and tell them that you don't need tons of pills. You can do other things like put ice on it. It actually works to control pain and swelling. If a person has chronic pain, I specialize in prescribing a medication called buprenorphine, which is in Suboxone. It is not, I wouldn't say, the safest thing in the world for people in addiction, but when you talk about comparing it to an opiate for long-term chronic pain management, I'd say it's far better. So there's a group of people who've been in recovery. They all raise their hands. Who recalls being anxious early on in recovery? A little bit? Yeah. I'd say it's fairly universal. It's just part of getting from this coping skill system that used drugs and alcohol for years and years to having no skills and dealing with the rest of the world, and you feel anxious. And so if you end up in a doctor's office before talking to your sponsor, you're going to end up getting medication. Talking with someone who's an addiction specialist in that situation, if you need help, could be